Chapter 1. Syringe Pump Installation. Attach the syringe pump on the infusion stand. And connect to AC power. Chapter 2. Power on and install the syringe. Long press the power button around 2 seconds. LCD will be on and there will be self-testing process after loading. Put the fluid inside the syringe. Connect the extension tube and prime the air bubble. Pull the barrel clasp forward to the end. Turn counterclockwise 90 degrees and then release it. Pull the plunger head down to the end. Then pull it out horizontally to the right. Put the syringe without air bubble on the syringe cradle. Turn the barrel clasp clockwise 90 degrees and then release it. The syringe pump will detect the syringe size automatically. Press the plunger head down to the end and push the syringe handle to the left horizontally until the plunger head totally connecting well with the syringe rod, and then release it. Chapter 3. Parameter Setting and Start Infusion. Press the function button to set VT/BI, flow rate, total volume and other parameters. Press rate button to set the flow rate. For example, flow rate 25 ml per hour. Press 2, 5 on the numeric keypad and then press Enter to confirm. To revise VT/BI, press VT/BI button. Set VT/BI to be empty, means finish all the fluid inside the syringe. Press A, B on the keypad to convert the parameter setting for channel A and channel B. Please make sure no air bubble inside the extension tube before doing venipuncture. If there is air bubble inside, long press Prime button to remove the bubble. The double channel syringe pump need to long press 0 to prime the bubble. Do the venipuncture after confirming no air bubble inside the extension tube. Confirm the parameter the same as the prescription and start the injection. Press Start, Stop to start the injection. After the injection starts, please observe whether the device can work normally and whether the patient has any adverse reaction not less than 1 minute. The hospital staff can leave until confirming all is normal. To change the parameter during injection, select the function button accordingly to change the VT/BI or rate. Please observe regularly whether the patient or the device is normal. Chapter 4. Injection Finish. The syringe pump will have near empty alarm when remaining volume is around 10%. The injection continues during near empty alarm. Press Clear to clear the alarm. It indicates injection finish when there is injection finish or empty alarm. Pressing COR can clear the alarm and injection stops. Press Start, Stop button if it is under KVO. Pull the syringe plunger head and hold the syringe, and then pull out the barrel clasp. Take out the needle and remove the syringe. Place the barrel clasp and plunger head back to the right position. Press Power button to switch off. Chapter 5. Display Information. Mode. The current injection mode. Injection status. Injection icon will be moving during injection. Injection icon will not move in standby status. Rate. It is the current flow rate. Flow rate range is 0.1 to 1,200 ml per hour based on syringe size. Pressure display icon. The icon will jump when there is occlusion. It will trigger occlusion alarm if it is not solved. VTBI, volume to be infused. VTBI is decreasing during injection and remaining volume. Empty means finish all the fluid inside the syringe. Time. It indicates the time needed to finish the VTBI under the current rate. Total volume. It indicates the infused volume. It will become 0 after restarting. Function button. It indicates different function in different interface. Press the button to use the function accordingly. Syringe brand. The current used syringe should be the same as the selected display brand, or there may be big deviation. Syringe size. It can detect the syringe size automatically and accept 5 ml, 10 ml, 20 ml, 30 ml, 50 ml syringe size. Mute button. Cross indicates mute status. The status can keep 2 minutes. Battery icon. It indicates battery status under battery supply. For double-channel syringe pump, the upper half screen is the display area of channel A parameter. The lower half screen is the display area of channel B parameter, which can be converted by pressing A-B button. Chapter 6. Button Introduction. Function button. It indicates different function in different interface. Press the button to use the function. Numeric keypad. To input the data for different function. CLR button. To clear the value. Long press CLR can make it in sleeping mode. Menu button. To enter the menu setting or exit the menu setting. Prime button. Double channel 0 equals prime button. Long press to prime the air bubble. Click prime button to the bolus function during working. Start button. To start or stop injection. Mute button. To make alarm silence, and the mute will cancel automatically after 2 minutes. Power button. Long press to power on or off. Power indicator. On indicates AC power connected and under AC power supply. Battery indicator. On indicates under battery supply. Flashing indicates battery charging. Chapter 7. Menu Introduction. Press menu to enter the setting of the parameter. Double channel syringe pump. Menu button is on the function button. 1. Injection mode. Mode includes constant rate mode, time, volume mode, drug weight mode, micro mode, programmable mode, drug library mode based on different model. Can select the mode based on the prescription. 2. Parameter setting. Select the syringe brand, KVO setting, occlusion level setting, prime setting, near empty setting. 3. System setting. Set date, time, screen brightness, system version. 4. Event log. Check the history record or search the record based on injection time. 5. Engineering mode. Get the password from manufacturer for the setting. Chapter 8. Alarm solution. After the alarm occurs, observe the patients in normal condition in priority and then handle the alarm following. If any abnormal condition of the patient, disconnect the device with the patient is the first option. Occlusion alarm. When there is any block in the syringe, it will trigger the occlusion alarm. Please check whether the needle is blocked. Extension tube is folded. The patient is pressing the extension tube. If the needle is blocked, need to do the venipuncture again and then restart the injection. If extension tube is folded or pressed by the patient, need to unblock the tube, press COR to clear the alarm, and then press Start/Stop to restart the injection. Injection finished. KVO. When VTBI gets 0, it will have finished alarm and enter into KVO mode. To finish the injection, please follow the step in Chapter 4. Empty alarm. When VTBI is more than the fluid inside the syringe, it will have empty alarm when fluid finish. To finish the injection, please follow the step in Chapter 4. Near empty alarm. It indicates the fluid is going finish. It keep injection during near empty alarm. Press COR to clear the alarm. AC power disconnect alarm. Check whether the AC power is connected well. If not connected well. Chapter 9. Syringe Calibration. New syringe pump or new brand syringe need to do calibration before use. Don't use the syringe without calibration. Prepare one new syringe. Pull the syringe rod more than a little to the maximum scale of the syringe scale. For example, 50 ml syringe. Pull the syringe rod more than a little from the 50 ml scale. Install the syringe correctly and keep the scale side outward. Prime the syringe rod to the maximum scale and stop. Select the syringe brand and size to be calibrated by step, menu, engineering mode, syringe brand management, add a syringe brand. Press the corresponding button and start the calibration. After calibration finish, press the function button to save the setting. Please follow the same calibration step for other size syringe.